Welcome to the Early Innovators Podcast, brought to you by Moodr Health, based in West Virginia. Moodr Health helps health organizations connect with hard-to-reach, vulnerable, and at-risk populations. Today's session pertains to community mental health support services. And today I'm joined by Amber Miller. Amber Miller is a leader at Prestera Health Services. And in this role, she oversees marketing, strategy, communications, and community outreach efforts for the organization. Prestera Health Services is a nonprofit behavioral health organization based in West Virginia. Founded in 1967, it provides a wide continuum of services, including mental health care, substance use treatment, crisis support, primary care, and more, to thousands of individuals and families annually. Prestera's mission centers on promoting wellness, hope, and growth in the communities it serves, with a particular focus on making care accessible regardless of an individual's ability to pay. And my name is Jim Murray. I work with Moodr Health in the role of a commercial growth leader, and I'll be the host of today's podcast. My career focus has been, to this point, around commercialization, innovation, and strategic partnerships. With that, let's get started. Amber, welcome. Thank you for being here with us.
Thank you for having me.
I'd love to start today with hearing from you. And if you want to incorporate into your response more information about Prestera than I provided, please do. But I'd love to hear about what brought you to Prestera Health.
Sure. So Prestera Health Center has been around since 1967. We actually got our start here in Huntington, West Virginia. We have a location on Route 60 that is still used to this day. It is our flagship location. We started as the Community Health Center. Today we serve 9 counties, and I'd say it's over now 700,000 appointments a year. So we do serve a very large population in the counties that we serve. So years ago, when we did first get our start, there was an individual named Michael Prestera who sat on our board, and he was a huge part of helping with the deinstitutionalization movement and also moving the state's catchment area from the northern part of the state to the southern part of the state, as they saw a much larger need in this area at that time. Unfortunately, Mr. Prestera was aboard the Marshall flight that crashed, and several years later, they decided, because of all the work he did for Prestera, they named the Community Mental Health Center in his honor. So that's when we became Prestera Center. And then back last year, we rebranded again as Prestera Health Services. We want the community to understand that we are more than just mental health. Even though it is a majority of what we do, we are an integrated healthcare center. So like you mentioned earlier, we do everything from primary care, health and wellness. We have crisis services, substance use. We have a program for veterans. We have residential programs, homeless services. The list goes on. It's really neat to see how many things we actually do. And I think every time I turn around, there's a new program that is opening to fill a void in the communities that we do serve. My piece in coming to Prestera, it started really a long time ago. I grew up with a father who was an alcoholic. And for 30 plus years of my life, I had a very bad stigma for people with substance use disorders because I didn't know any better. I was lucky enough that the last several years of his life, he chose to start his recovery journey. And I developed a wonderful relationship with him. I'm sorry.
That's quite all right. Take the time that you need. That is certainly a heartfelt answer. And you hadn't shared that particular part before, and it's touching for sure.
Growing up in a household like that and knowing those things, like I said, I had a stigma against that. Right before I made the move from Morgantown to Huntington, one of my very close friends, her twin brother, who was a veteran, he served his country very proudly. He was the light of every room he walked into. He supported veterans that were going through the toughest times of their lives. He was always there for everybody. He was just a tough guy. Everybody's like, oh, he'll be great. He'll be okay. He never has any issues. And shortly before I moved here, I will never forget the day that she called me to let me know that he had taken his life. And at that point, I knew that I needed to do something different with my life. She and I both actually made very big career changes and career shifts. to honor his memory. And also from my dad, I just felt like I needed to turn my focus on a community that needed help. So that's how I ended up here.
Thank you for the service that you're doing every single day. And thank you for sharing those heartfelt stories with us. Behavioral health is often about helping people find hope again. And I'm interested in whether or not we can move in the direction of Prestera supporting a uniquely diverse and often underserved population.
Sure.
What are some of the most pressing or complex needs that you see in the population that you serve?
So one of the biggest things that we see is most times that when we are dealing with someone that has a substance use issue is they're also suffering from a mental health issue as well. So a lot of things we do is what we call dual diagnosis. We make sure that they get the complete care that they need. So when you have someone that may have a mental health issue or a substance use issue, but they also need someone in primary care, all of our focus then moves to that individual, and all of those providers then work together to make sure that these people are getting exactly what they need, and that the communication is, it's not a, we understand what they're saying, we understand what they're saying over here. It's, there's someone there to help to make sure that communication is correct and that things are getting transferred back and forth correctly. Not to mention that, but a lot of people in this area, they have issues with transportation. They can't get to all of their appointments, or they can't make it from one county to another. It's, we will pick them up, we will get them there, we'll make sure everything's taken care of. We're there to answer their questions, and we offer a support system. So, you know, even after their appointments are over and they need support and they need someone to talk to, there's somebody there to do that for them.
Fantastic. I'm curious if perhaps there's a story you might be able to recall of transformation or recovery that's stayed with you. What kinds of support really have made a difference in a particular person's story?
Yeah, so there's actually one story that sticks with me anytime somebody asks. When I first started here, there was an individual, he and his wife both went through incarceration. They came to us through one of our short-term recovery programs. They both moved up through short-term into midterm, and actually both ended up in what we call our SRO, or it's single resident occupancy apartments. What those are for individuals that have dealt with substance use. They are a very low rent payment. There's no utilities or anything like that. It's a little efficiency apartment. It's here in Huntington. And with that, when they came in, he really was ready to change his life. So he worked with some of our workforce support programs. I'm sorry, back up and start that again. So when he and his wife came in, they both wanted to get back home. That was their goal. They had a family, they had young grandkids. They wanted to be there to see their grandkids grow up. So they worked with our workforce support program. He became one of our janitorial staff at the location that he was in. And what was so cool about that is it's a program that he had gone through, that he was continuing to go through, and then he was serving people that were doing the same as he was. So he truly understood them. He was one of the most kind and just thoughtful people I have ever worked with in my life. We had started a program last January. It's called our Patty Raines Service Excellence Awards. Patty Raines was one of our front desk employees. She was here for, I think, very close to 50 years. But she was known. People would love to come talk to Patty because she was such a gentle soul and truly served our people. We couldn't have asked for better. So we started an award in her honor, and he was actually one of the first recipients of that award. And it was, I still to this day remember handing him that award. He broke down in tears. He was just shocked that people were paying attention to him and he was making a difference. Several months ago, he and his wife actually completed both of their programs, moved back home. They're both doing extremely well. We do still keep in touch with him and find out what they're doing and how things are going. And he's still thriving. And I see a lot of that from the people that we serve. They're just happy to be here. They're kind. They are the first person to open a door for you or hold the door, ask you how your day is going. And some of these people are going through the worst parts of their life, but they see the hope, and that keeps them going every single day. And that's just, it's one of my favorite parts of my job.
It sounds inspiring to hear that from you. You had mentioned serving 9 counties and providing support to over 700,000 appointments each year.
Yes.
Very large number. What does that scale of impact mean to you? How do you keep your mission personal across such a large and diverse footprint?
First off, West Virginia is like no other state I've ever been to in my life. We have one of the most diverse populations I've ever seen, some of the most hardworking people out there. Every county we serve we're in Cabell County. Huntington is the largest city in the state. We're also in Boone County, Lincoln County, and Clay County. Their populations aren't nearly as large as ours are. That is a big difference, and you have to figure out how to be able to serve people from both of those populations. We also have a very transient community. We have a lot of industry coming to this area. We have Marshall University here and a lot of people coming in. So you have a lot of people that end up staying here because they fall in love with the area that aren't from West Virginia originally, but now they are. They are proud of being part of the state. So their look on things is very different, and the way that they do things, the way they see things is very different. So we always have to be moving and changing and evolving to make sure that we are caring for people from really all walks of life.
I know that you've said, we've talked before, many of your staff come from the same, your example a moment ago, many of your staff come from the same communities they serve, sometimes even as former clients. What kind of impact does that have on the culture within Prestera?
So I know one of the biggest positions that is our recovery coaches. And when you are going through something, no matter what it is, if you are working with someone that has never been able to, for lack of better terms, walk in your shoes, they truly don't understand. So when you're able to work with people that have gone through the program, they understand when you say, I'm having a terrible day, or it's the worst day of my life, or this has happened, or that's happened. They know what that is. They get it. They understand, and they are able to provide that support to them, to sit, to listen, to have a conversation, to not judge, which is a huge piece of that, especially in recovery. Everybody that we serve, they're all humans. They're all people. And at the end of the day, every single one of them deserves to be treated like we treat everybody else. The stigma around that is terrible. I said earlier, we'll say I was one of those people years ago. I didn't understand any better, but my outlook has absolutely changed. And I really, truly feel that that is one of the biggest things that we do. We are part of our community. We don't just live in it, we're part of it as well. And that is the biggest thing that has helped Prestera over the years, to understand how to move people forward, to get them better and to get them where they need to be.
Amber, I'm curious of your perspective. Behavioral health organizations everywhere are facing staffing shortages, funding constraints. My mom has said my whole life, work is spelled W-O-R-K, not F-U-N. So at the end of the day, this is your work. So there are challenges to the work. You're telling some really inspiring stories here, but there are challenges. What are some of the behavioral health or social challenges across these diverse regions or counties that you serve?
Like I mentioned earlier, the counties that we serve are all very different. So one of the biggest things that we see is transportation. It is a lot of times hard, and especially some of our more rural counties, to find employees because it's a trek. Driving an hour to work just does not work for some people sometimes. Being a nonprofit organization, it's been hard for us to keep up with for-profit organizations that do the same things that we do. We were lucky enough last October to become a CCBHC, which is a certified community behavioral health center. That has allowed us to be able to raise wages for a lot of our employees and to be able to bring in employees that we before could not, because we are now competitive with those wages. So that has been a big piece of it. The other piece, like I said, about transportation is not just for our clients, or not for just for our employees, but when you're in an area where we're in some of the most rural parts of the state, people cannot access, a main highway to be able to get to us. So that is something that we have been working very hard on, is going to the people that we serve. If that's through telehealth, being able to go online and meet with a provider, that has been huge for us. It also allows us to bring in providers from other areas to do telehealth, so that we are making sure that we have the best of the best, being able to help treat people that are in need. We have started with our mobile units. We have several that go out to the regional jails. And that way, when people come out of incarceration, we're right there to make sure that they're getting the help that they need. That is a big thing, especially in this area with communication. It's instead of yeah, I know you're there, I'll do it later. No, let's do it right now to make sure this is taken care of. We have also bought some 4-wheel drive vehicles that will get us back into some of the more rural areas. If we need to go get somebody or we need to provide services to someone in need, we have that capability. For us, again, it's back to the human element. We want to make sure that our people know we're here, that we'll take care of them, and we're going to do whatever it takes to make sure that happens.
So as far as getting the word out and considering some of the roles and responsibilities that you have at Prestera, are you relying upon word of mouth? How do people know?
Yeah, word of mouth is definitely a big piece of it. We are very vested in our communities. So we do work with a lot of other organizations that refer people to us. We have several counselors in a lot of the schools in our area. So we get a lot of referrals from them. I have referrals come in. The referrals that come in to us daily, they're from everywhere. I have referrals that come in from all 55 counties in the state because there might not be a service somewhere else in the state, but they know that we have it. So the people that we do serve, yes, we only serve 9 counties. We serve the entire state of West Virginia. So that's a big piece of it. Being around since 1967, I have people call and say, I've seen you've been around since 1967. You must know what you're doing. You didn't just come into the market and close a couple years later. It's that faith that they have. We are a piece of this community, and we continue every day to try and grow those partnerships with other community organizations to make sure that, again, our community is taken care of. Someone mentioned to me a few weeks ago, I was at another leadership Huntington, actually, and we were out visiting one of it's a heritage farm, actually. And the guy that was out there, he said to us, he says, there's hard. Everybody says things are hard. He said, they're not hard. He said, if you want hard, go back to the 1890s when you had to plant your own food and you had to do everything yourself. He said, it might be frustrating. It might not be easy. He said, but it's not hard. He said, people in this region in the country need to learn how to Appalachian up. And I just thought that was one of the greatest things ever, because the people in West Virginia know exactly that. They know how to Appalachian up. They know how to be there for people. They know how to support their neighbors. They know how to be part of the community. And that's what we try to do as well.
I think learn to Appalachian up should be a bumper sticker. And if it isn't,
it definitely
should be a really great business opportunity for you. As far as other kinds of external support, I work at a technology company, which I'd said at the onset of the podcast, helps health-focused organizations connect with hard-to-reach populations. So where might external support have the greatest impact for addressing these gaps? So you mentioned geography and the rural aspect, access to care, word of mouth. Are there additional support mechanisms that would help you be able to do your job to a greater capacity or reach more people, reach people where they are? What does that look like?
So I think in a lot of cases for us, we have to go back to the basics. When it comes to tech, everybody thinks of tech as technology, computers, internet, things like that. And those are absolutely things that we need. We need better internet into a lot of these rural communities. We need more access for people to have a smartphone that they can get on to do their telehealth, or computers, or different things like that. So when it comes to actual tech, just making sure that they are up to speed. Unfortunately, a flip phone is not going to be able to do that. And there's a lot of people in these communities that they still use that. Some people don't even have cell phones. So getting the actual technology to them is a big piece of it. But the other part of that is everything comes in waves and we go different directions. And for us, I'm going to go back to our people as being part of our technology. That human element is what helps people get better. It's knowing that there is somebody there. It's not talking to a computer. It's talking to a human. However, that technology is what gets those human interactions together. It's that piece of tech, that internet access, that understanding how to use that technology in a lot of cases is a big piece of it. But it's also using the technology to back again to connect that human element, the people understand that there is someone on the other end of that phone that's going to ask them, hey, are you okay? What can I do for you? Can AI and things like that talk to you? It sure can. But there's no human element. There's no emotion behind that. And when it comes to anything that you're trying to heal from, whether it's an injury, whether it's overcoming something, human is where it's at. So that's a big piece of us impacting our community. I would love to be able to see the state get to a point where I don't drive through a piece and lose cell service. There's still a lot of those areas here. When you're losing cell service, guess what? There's people in that area that might not be able to call for help. They might not be able to get what they need. So I think still in West Virginia, a big piece of that is very much so the basic technology.
Having come out to West Virginia a few times this year, you remind me that I was unprepared the first time. I absolutely pack a book on CD now, for sure. The radio is not always there. Beautiful
No,
radio,
it's not.
but a lot of windshield time where I can self-reflect, for sure.
Yes.
So I'm curious, in your lens then, how do you measure the genuine improvement to client outcomes? Because coming from an enablement platform such as Moodr Health, working with health and wellness care providers and insurance payers to try and help them connect with people, yours is a great example, that are otherwise either rurally located or have gaps in being able to reach the care that they need when they need it. How do you measure that improvement? How do you know that you're doing the right thing at the right time?
I have always been one for improvement is always something that shows when you see your services in your business picking up in general. I know that when I see referrals come in and somebody was referred by somebody that's been here, it means it's working. It means that it's doing the right thing. And therefore they're telling other people about it. To me, it's when I walk into one of our clinics and the waiting room is full. People are coming to us. I tell people all the time that my goal is to not have a job. And meaning that is I don't want my job to exist anymore, because that means that we have fixed several different things. Unfortunately, I don't know if I will see that in my lifetime, but that is my goal every day. Is I don't want to be able to have a job at Prestera, because I don't want Prestera to have to exist. And I think most of the people I work with are very like-minded that way. That is their goal, is to get to that point where we have, I don't want to say solved, but we have transformed behavioral health. We've transformed a lot of our substance use and things like that. There will always be a need for some of the things we do in primary care and health and wellness and little things like that. But yeah, that's my end goal, is to not be here.
That's probably a great segue then to one of the wrap-up questions here. When I first met you, we sat down for lunch. I was marveled at how many hats you wore and how could you be literally in different geographies simultaneously and do such diverse tasks across a myriad of job responsibilities. So when you look forward with new crisis centers, low barrier shelters, veteran programs, what's next for Prestera then? What future innovations are you most excited about?
I will say for me, and I've learned that I swear every time we turn around, there's something going on or a new clinic getting ready to open. We did just put 2 brand new primary care clinics in our Mason County and our Wayne County offices. Those are both areas that don't have a lot of options. They don't have a lot of options for care. So we needed to put something there. Like I said, the mobile units launched earlier this year. Our veterans programs continue to grow every day. When I met with our CEO, Lisa Zappia, not too long ago, she had all kinds of ideas. We're always looking for that next place that there's a need, that there's not a service, whether it's a small area or a large one. We want to make sure all those gaps have been filled in. And it is crazy as it is. It's little things. We're doing all types of renovations to our buildings to make sure they're more accessible for people. Our 511 Morris Street in Charleston, it's our largest location, and they just redid our lobby so that when you walk in, you're making sure that you're connecting with someone that can answer all of your questions and not having to go off to the side, or you walk in and you're going, okay, where do I go? What do I do? So we're making sure those people right there up front, ready for the people that we serve. So it's every time I turn around and we finish up one project, there's something new coming. So it's a really exciting. It's always something different. And I look forward to coming to work every day.
There's no slow days, are there?
No, there's not. And I wouldn't have it any other way.
Very good. I'm curious if you could wave a wand and make one problem go away today. Only one, though. Is there one that's at the top of the list, or is that a hard list to form?
I think if I could wave a wand, it would be to educate our community so that they understand what we do, to educate them about stigmas and to educate them why that everybody knows somebody that could benefit from our services. A lot of times they don't realize that. Mental health, substance use, it affects everybody. It's not just someone on the street that needs help. It could be someone that you're related to, someone that you have no idea is going through those things. It could be someone that is the major CEO of a company or a doctor or a lawyer that we give the highest regard to. These things happen to all of us, and we have to be prepared and educated to be able to help those when the time comes. You can't just say, oh, that's not going to happen to somebody. It was like I told the story earlier of a very good friend of mine, her twin brother, and what he went through. Nobody ever thought that would happen or anything like that would happen, but unfortunately it did. Were there ways that we could have helped him? That's a question I can never answer. But being educated and understanding better gives us a chance to do that. And I think that's our biggest thing. We need to educate, and we just need to be more open to helping others around us.
It's fantastic. Probably a good time to wrap this. I wanted to thank you, certainly you as well as Prestera, for being model support pillars of the community. I think that the last question that you answered there has been really in my face and several coworkers that I've gone through this professional part of my life with for a number of years. And there are some statistics that say 1 in 3 people are personally impacted, either themselves or somebody close to them, with mental health needs.
Mm-hmm.
The suicide rate of veterans continues to not dip below 7 a day, which
Correct.
is just marvelous in and
Mm-hmm.
of itself at face value, but that it hasn't changed. It hasn't gone down. So the sorts of support services that you and Prestera are providing are gravely needed, and we thank you for that. Thank you for the time you've carved out for sharing with us today, and we'll see you next time. I'm in West
Thank you
Virginia.
so much.
Thank you.